Okay, now here is your question. Right, so if you have read and understood considering its surgical pathology station, please tell me, considering the stem of the patient, what differential diagnosis would you consider?
Yes, it includes the septic arthritis, osteomyelitis, osteoarthritis, gouty arthritis, and maybe history of recent trauma.
Okay, right. How would you confirm your diagnosis?
I would go for the joint aspiration and further workup that includes gram staining and culture insensitivity and chemical analysis of the aspirate.
Right. Okay, you said analysis of the aspirate. Right. You've done the aspirate, and in order to establish your diagnosis, what organisms positive do you expect to see?
Yes, as this is the adult patient, the most common organism would be Staph aureus and Staph aureus, Enterococcus, and Group A Streptococcus.
All right. Considering the patient had the history of knee plate for the fracture, which patient had 3 years ago,
Yes.
what complications could that result to?
That can act as a septic focus and can cause osteomyelitis in the future, and that can lead to osteoarthritis and osteomyelitis as well,
Is
and
it
septic arthritis.
isn't it too late for septic focus to develop? Three
Uh,
years, more than 3 years.
yes,
So most likely diagnosis could be osteomyelitis. Can you tell me the pathogenesis of osteomyelitis? How does it occur?
yes, ma'am. The pathogenesis could be secondary to the hematogenous spread or the exogenous spread, but it is due to the inoculation infection of the organism due to the
Yes,
metaphyseal arteries that
yes.
goes towards the metaphysis of the bone, and due to acute turn and due to slow blood flow, the bacteria inoculates in the bone, and there is loss of phagocytic cells in the bone at that area. So when there is infection of the organism, there will be the stage of acute inflammation and separation that will lead to the pus formation. And when there is pus formation, there will be the necrosis of the bone at that site. And once there is necrosis of the bone, there will be surrounding reactionary new bone formation by the periosteum that is called an involucrum. And that's how the osteomyelitis can be formed.
Around at what day of infection involucrum occurs?
It's around 7 to 10 days after an infection.
10 to 14 days. All right. Can you please tell me, in order to for the resolution or the continuation of the infection? All right. Okay. These organisms, if you can tell me, they infect the bone according to what three basic methods?
Yes, they could be hematogenous spread.
Yes.
There is exogenous spread,
Yes.
and there could be direct continuity of the infection from the surrounding structures.
All right. Good. Uh, which causes, okay, there could be even trauma, direct or iatrogenic as well. All right. Where exactly do you think this osteomyelitis takes place?
At the metaphysis.
All right. What happens exactly when metaphysis is affected and infection enters through bloodstream?
Yes, when there infection at the metaphysis region, there will be the onset of acute inflammation and suppuration. due to which there will be the pus formation at the level of the metaphysis and the medullary cavity. So this pus expands laterally via the Volkmann's canal, and there will be increased intraosseous pressure that will elevate the periosteum.
Good. Can you define the term pus?
Yes, pus is the product of the acute inflammation that consists of an exudative fluid that contains the dead neutrophils and a pyogenic organism and tissue debris.
Would you be able to define the term necrosis?
Yes, ma'am. Necrosis is the type of cell death that accidental cell death that includes the rupture of the cell membrane and leaking out of the cell contents that will lead to loss of ion hemostasis and eventually cell death.
Good. You've established your diagnosis. Now, what management alternatives can you suggest to this patient?
Yes, I will run all the cultures that includes blood cultures, and if there is open wound, I will go for the wound culture as well. And according to the cultural sensitivity, I would start antibiotics targeting the Staphylococcus aureus and group A Streptococcus organisms. That includes cephalosporins, co-amoxiclav, and there will be a combination of fluproxacillin and gentamicin. And I will offer him painkillers and for the pain relief, and I will do splintage of limbs for the relief as well. And if there is any evidence of abscess, I would go for the surgical drainage.
What else would you do?
Can you please
One more important thing that you'll be doing for the management.
yes, for the removal of the knee plate.
Very good. Yes, because that has become septic
Yes, ma'am.
focus.
Yes, ma'am.
Right. After you've managed the patient, right? Patient presents after 3 months and the wound is not healing. What would you suspect?
That is a surgical site infection.
All right. All right. Okay. How would you manage that?
Yes, for managing infection, we would require the culture and sensitivity from the wound side to qualify what organism is it. I will go for the swab test and send for culture sensitivity.
Right. You've managed it. You've sent the man home. Patient comes back to you after just say 4, 5, 6 months, and again there is a spot which is like oozing out, and there is still infection, and you think that okay, what would you do then?
Then I will evaluate the patient for possible of squamous cell carcinoma,
Very good.
as there
Yes.
is chronic irritation, so there will be evidence of any malignancy in
Yes.
that sinus.
How would you manage that? Yes.
Uh, that would require resection
Yes.
of
Before
that.
that, you'll discuss it with.
Yes, I will discuss it with the multidisciplinary team for
Very
the
good.
management
Yes. Yes.
and do all the staging workup, whether it is localized or any disseminated disease, and I
Yes.
will proceed for the definitive management of resection.
Yes. Very good. All right. This has been done. Devices. What I had to ask you, if you can tell me you've already told me all that. How the bone gets its blood supply?
Ma'am, the first thing is the metaphyseal arteries,
Very
and
good.
there
Yes.
is two broad classification of the bone when it comes to structure. The one is compact bone, and the other one is the lamellar bone. The compact bone has the Volkmann canal, and sorry, the Haversian canal and the Volkmann canal that provides them the blood supply.
Good. Yes. Right. And once it's causes infection, what happens to the distal part, the epiphyseal part, or the distal part of the bone?
So, uh,
They get deprived of blood flow.
the blood supply, yes, ma'am.
Yeah. Good. Very good. Excellent.